Hello, everyone, and welcome to another episode of the Overcoming Chronic Illness podcast. My name is Dr. Brian Rade, and I'm a naturopathic doctor. And today I am joined by a fellow naturopathic doctor from the US of A, Dr. Kathleen Janelle. Dr. Janelle is someone I'm really excited to speak with because I took a course that she put on several months ago. It was all about something called high dose sulfur therapy, which basically involves using high doses of a supplement called MSM. MSM is an acronym for methyl sulfonyl methane. MSM's been on the market for many years. It's part of a lot of joint support formulas, but it turns out that MSM is useful for a lot of other conditions. And to my understanding, that's largely because it's working to correct a sulfur deficiency that is a deficiency that I didn't realize that so many of my patients have or had. But after taking Dr. Janelle's course, it really opened my eyes to the very widespread uses for sulfur supplementation using MSM. And it's really all about the high doses that she talks about that really makes all the difference. I've used MSM with my patients for different musculoskeletal conditions, primarily arthritis, for a number of years, but using those higher doses of MSM have made all the difference for a wide range of conditions, ranging from digestive disorders to skin issues to, well, certainly still joint issues. Just the higher doses seem to work a lot better than the lower, more standard doses that one might use. I've seen improvements with skin issues, nail integrity, seems to upregulate detoxification pathways. Some patients have better energy, better mental clarity. So seeing quite a lot of benefit for my patients. So I'm really thankful to Dr. Janelle for putting this information out there in the first place that I could learn from her. But then I'm also really thankful she's taking the time to speak with me today because I have a whole bunch of follow-up questions based on what I've been seeing in practice. And I'm just excited that those of you listening to this episode are going to be able to learn more about the potential benefits of sulfur/MSM that are available. Just before jumping into the podcast episode and bringing Dr. Janelle into the conversation, just want to invite anyone who has not signed up for my newsletter to please consider doing so. You're more than welcome to. Signing up for my newsletter gives you complimentary access to the first two modules of my Overcoming Chronic Illness course. There are several modules within that course, ranging from mitochondrial dysfunction to mold illness to Lyme and co-infections to chronic digestive disorders, detoxification pathway issues, including things like heavy metal detox and whatnot, and a number of other topics as well. There's a course that I designed to help folks to navigate the challenging waters and complex waters of complex chronic illness. And it's a course that I hope is helping folks that are out there. So if you're interested in kind of checking that out, then the first two modules are available at for no charge. And if you do sign up for my newsletter, then you'll also get updates from me periodically. I don't send them out very often. I promise I will not bombard your inbox with emails, but I send out periodic newsletters just talking about things I'm excited about in practice, like MSM and various other topics, talking about upcoming podcast episodes. I sometimes do live Q&As, different things like that. So if you'd like to be in the loop, please consider signing up for my newsletter. The link for that is in the show notes if you're listening to this on a podcast platform, or available in the description of the video if you are watching this on YouTube. So with that out of the way, I will pause the recording and be back in just a moment with Dr. Janelle. All right, folks. Well, welcome back to the podcast. I'm now joined by Dr. Janelle. Dr. Janelle, thanks so much for speaking with me today.
You're so welcome. It's great to be here.
Well, thank you. I'm very excited to chat with you. I've got a whole bunch of questions for you, but just before we jump into that, would you mind just giving listeners a little background on who you are, where you practice, and maybe tell us a little bit about what this sulfur business is all about, please?
Oh, sure. So I've been in practice for over 25 years, and I was initially in practice on the East Coast in southern Vermont was where I started my residency and got into more family medicine and pediatrics at that point. When I returned back to Washington after the residency was over, I really started to focus on digestive issues and trying to elucidate some of the natural protocols that we could use to find out what's really going on here and treat our patients successfully without having to go towards a large contingent of pharmaceutical medications, which I found in those days weren't really doing anything anyways. There's a very short list, and a lot of them aren't really effective for any kind of long-term resolution for patients. So I was really started digging around in that area and seeing a lot of digestive patients. And so currently I'm in Seattle and I practice out of Seattle.
And how did sulfur come across your radar?
It was a personal experience. So all during the time when I was a resident and when I was in medical school, I was having the issue that my patients come to me with now all the time, all over the world. And that's this gassy, bloaty distension that doesn't seem to have any kind of identifiable etiology. And so since I was in naturopathic medical school, I was a resident, I had all of this information, and I knew all the things that I was supposed to do with my diet and with digestive support and everything under the sun. It really didn't matter. It didn't matter if I didn't eat anything. It didn't matter if I just had water. I would have this bloating up in the central abdomen every day. Some people tell me that when they have that sensation, it's cramping and painful. Other people, it's just that uncomfortable distension, but it's basically fermentation, right? It's gas. Something is fermenting inside the intestines that should not be there in the quantities that it is. So I went through the process of all the things I knew. Like I said, digestive support, HCl, pancreatic enzymes, ox bile, diet changes, diet testing, microbiome testing. What we had back then in the 90s is not as sophisticated as what we have now, but all of those things I tried. And homeopathics, I tried some antibiotics, I tried antimicrobials, I tried antifungals, both herbal and prescription. Nothing touched it. And I can really relate to my patients when they tell me that, because you kind of like, if this goes on for 10 years, like it did for me, you're always thinking, okay, what's the next thing I'm going to try? You try and you're like, okay, tomorrow it's going to be the day. Tomorrow's going to be the day where I'm going to hit, lunch, and I'm not going to blow up like a balloon. And it just keeps on happening. So it's really frustrating. It was really frustrating for someone like me, who I felt I should know how to do this. I should know how to fix this, but it's me. And so just by providence, a friend of mine who's also a doctor in the area said, you should talk to this compounding pharmacist, because she told me about using high dose MSM of sulfur for this problem. And I thought that sounded ridiculous. I didn't know anything about the antifungal, the antimicrobial properties, the structural properties. All I knew about MSM was that it was an anti-inflammatory, and we used it for, joint diseases, maybe myalgias. So, but I really didn't have anything to lose at this point, and I'm curious. So I talked to her and she told me what to do. And at that time, actually, you couldn't get MSM in a powdered form. There was usually in a mix with something else anti-inflammatory, for joints. And so I had to get it from her. She supplied me with the crystallized MSM. And that's really what I kept in stock in my practice for many years until it became available on the commercial market. So I did what she said. I did a titration. I increased. She warned me that I might have some die-off-Herxheimer's reactions at first, or sulfur upregulation reactions. So she really prepped me for it. I went through the protocol and did the 8 weeks of high dose sulfur. And I've never had that symptom again. Never. It was gone. And I don't, we're going back like a few decades now, so I don't remember exactly when the magic part was for me, but I do remember there was like a click over, and it was like, oh, that day happened where I didn't blow up like a uncomfortable balloon. So interesting, right? And I'm just thinking about this right now, how digestive issues can play into so many of the other aspects of health for people, and how, I was definitely in a chronic fatigue place at that point for myself too, because of how much work was going into just what was happening in my gut, more than likely, and not absorbing nutrients well, et cetera, et cetera. Medical school, residency, all those things piling up. So not only did I feel like I was blown up like a balloon after noon, I was also so tired that by the end of my day, I never planned anything in the evenings, because it was this double whammy of being absolutely exhausted and feeling uncomfortable at the same time.
It's so all pervasive when your gut's a big mess. So yeah, it's really great that you're a success story. And so from there, you started using it with your patients in practice, and the rest is history. I'm assuming the story goes something like that from there.
Yeah, pretty much. Although what happened for me was that I went to teach at Bastyr University. They had a GI thing happening, and so I dropped in to do a teaching gig. And as I was sitting there in the audience watching some of the other information, I was shocked to find that people were being diagnosed with SIBO, small intestinal bacterial overgrowth, which is a fermentation condition, and being treated with antibiotics. But then I'm listening to this protocol that's being laid out. And it's like, well, it goes away for a little bit, and then the symptoms come back. Well, you give them more antibiotics. And then it goes away for a little bit, and the symptoms come back. Well, you give them more antibiotics. And I thought my mind was kind of blown sitting in that audience, like, where am I? This is not the place that I went to school. The place that I went to school at was where we learned how to use the least force, use natural as much as possible, do no harm. So it started to bother me that this was really out there and being taught to the students as an acceptable protocol when I knew that there was a really good alternative. So that's when I wrote my book. And that's when I started speaking more publicly, to give doctors the option and give patients the option. Because when you take the antibiotics, Xifaxan, I've got a study here that I can, uh, link or send to anybody. And it's probably in some of the videos I've done on YouTube. But there's a 45% recurrence rate after Xifaxan. So over half of your patients, like 55% of your patients, might get complete resolution from their symptoms by taking an antibiotic, but almost half of them will basically go back to where they were.
So I think that's a great launching point into like what's the magical thing about MSM or the sulfur that's within the MSM in that, at least in my practice so far, like I've had a growing number of patients who have been completely refractive to, Xifaxan, also known as rifaximin for folks listening. Um, you know, every herbal treatment you can think of, every diet, etc. So, and of course, those therapies do work well for some folks. But what is it about MSM that kind of makes it stand apart? Is it that it's the strongest, antibacterial agent out there, and it just, blows Xifaxan out of the water, or like, is it working on some deeper root cause as well? What's so magical about it?
I think it's because it does so many different things, right? So, if we kind of go in and spearhead what we think is the problem, which is the small intestinal bacterial overgrowth, um, personally, I don't think that's the problem. I think that's the result, right? And I think that result is coming from, in some ways, a sulfur deficiency, which we can get into, as a separate topic. But no, I don't think, to answer one of the questions that you had there, it's not a superpowered antimicrobial or antifungal. It's a very gentle antimicrobial and antifungal, and it works with the immune system to get that alpha diversity back in the system, to decrease the growth in the small intestine, and even help with the large intestine. Because I'm treating people who have been diagnosed with SIBO, over and over and over again, and also people who have what I believe is a fungal overgrowth in the large intestine. Really hard to get a sample sometimes to really validate that. But a lot of times I think from the Xifaxan perspective, these people who have had like 4 or 5 courses of it, now they've got a fungal problem too. So it's both an antimicrobial and both an antifungal, and you have to get it up into high enough doses to get that effect throughout the intestine, right? Because the intestine's 30 feet long, and you're going to get really easy passive diffusion of MSM across the intestinal wall and the small intestine. You want to have enough of it to be able to make its way down into the colon and also do what it needs to do in there, but you're absorbing it too, right? The studies have shown that within 24 hours of taking a dose of 5 grams of MSM, you've got a diffusion throughout the body in all the tissues. You've got it in the brain, you've got it in the muscles, you've got it in the kidneys. It goes everywhere, and it has no downside. There's really no known toxicity. There can be some, ramp up initial reactions that the body has to deal with, or die-off reactions, but there really is no known toxicity when you use it. And, like we talked about before, the doses that I'm using, they're low compared. There's a large margin of error. I'm talking about doing a 30-gram dose, and the studies have shown, through the FDA, has shown that it's safe up to 4,000, so 4,000 milligrams per kilogram per day. So if you translate that into a 150-pound person, you're talking about 272 grams per day, and we're doing 30 grams a day. So wide margin of error. It's not even really that high of a dose. I just kind of call it that because it's an unusual dosing.
I guess calling it unusual dose sulfur therapy wouldn't have as much of a ring to it as high dose sulfur. So yeah, it's better branding maybe with high dose.
Probably not. Yeah.
Yeah, yeah. As far as it being able to diffuse through the tissue so easily, I just know some of my listeners are quite discerning, and they're like, that sounds a little too good to be true. But I'm just wondering, I know there's the research literature to validate that, but is it because, to your knowledge, is it because the molecule is so small that it's able to diffuse so easily?
Correct. It does not need a transporter. Like if you look at our food, right? Our food breaks down into, take proteins, break down into amino acids. There's a transporter on the cell, on the inner lining of the small intestine for each of those amino acids. They get broken down, building blocks, transported over. Something as small as an MSM molecule does not need to have a transporter, so it's actually able to diffuse into the system without that and then travel through the body. Same thing with hydrogen sulfide, which will probably come up a little bit later when we talk a little bit more about hydrogen sulfide gas.
Great. Well, maybe we could circle back around to the sulfur deficiency that you mentioned, because I know when I took the course that you put on through my alma mater, CCNM, Naturopathic College in Ontario, that you spun a very good yarn, talking about how, based on, I think largely on Dr. Stephanie Seneff's work, that a lot of us might be dealing with a sulfur deficiency. And I know for me, one of the things that was really exciting was like, hey, like Dr. Janelle, she seems like a credible doc, trustworthy doc. She's been at it for quite a long time, 25 plus years, and she's seeing all this has all this clinical experience, all these successful cases, treating challenging cases. But just the fact that you were talking about using something to correct a potential deficiency, as opposed to like Dr. Janelle found like, this exotic plant from the middle of the Amazon rainforest. One company has the patent on it, but like, oh, it's been working in all these cases. Like, I love the fact it's not this like, Cinderella story about, some exotic thing. It's more like, oh, we're just correcting this innate deficiency, this, incredibly crucial, component to our physiology. So the deficiency piece really excites me a lot. So would you mind speaking to that a little bit, please?
Oh, for sure. And I think the most important thing to build this on is that we don't store sulfur in our bodies, right? So we have these molecules that are useful for us that are always active, right? We're never going to have a store of sulfur. Sulfur is a mineral. It's the fourth most common mineral in our bodies. And we have double the amount of sulfur that we do of magnesium. And then let's look at another mineral, calcium, right? Calcium is stored in our bones. So when we need calcium, we liberate it from the bones. When we have too much calcium, we pack it back in there. Sulfur is not like that. Sulfur is active, right? It's being used for transport. It's being used in glutathione. It's being used in NAC. It's being used in cysteine and then that whole methylation pathway. It's being used as methionine. Methionine is the universal sulfur donor that initiates those pathways. So I don't want to detract too much. Let's talk a little bit now about, so those are the places we're using sulfur. Those are the places it's moving through our system. And obviously we need a daily requirement of sulfur because we're not storing it. So let's talk about glyphosate. And this is the work that Dr. Stephanie Senev, an MIT researcher, brilliant woman, has based a lot of her studies and literature on, is glyphosate. So just for your listeners to make sure they know what glyphosate is, it's the active ingredient in Roundup. And what it does is it impacts something called the shikimate pathway that's found in plants and bacterial species. It's not found in humans, which is how the manufacturers are able to get away with saying, well, it's not going to impact humans, but it impacts our microbiome. This glyphosate, it's the pesticide that's used in when you see something that's GMO or Roundup ready, that means that the plant has been engineered to tolerate glyphosate. So you can spray as much of it on you as you want onto the crop, like let's say corn, for example, and everything else dies. All of the pest species die around it, and there you go, voila, you have a beautiful corn crop. So you have your end result. Unfortunately, however, it also goes into the soil and impacts the microbiomes in the soil. And I do have some studies that show that the microbiome population in the soil that fix sulfur into the plant are impacted by glyphosate. The microbiome species inside of us that actually are helping us metabolize different plant forms of sulfur, the thiols, etc., are impacted by this pathway as well. So we're knocking down the population of that species, which is another reason for small intestinal bacterial overgrowth, right? If you're knocking down certain species, something else is going to take its place. So that glyphosate makes sulfur insufficient in our system, the circulating sulfur insufficient. And that is hard to put your finger on because sulfur is so mobile in our system, right? If you're lacking in calcium, you're going to have weak bones. If you're lacking in sulfur, it's going to be a little more insidious because sulfur does so many things that are functional in our bodies. For example, transport. So the glyphosate makes the sulfur insufficient. And one of the ways it does that is glyphosate is a glycine analog, right? So glycine is one of our amino acids that builds the polypeptide chain that makes a protein. And you could substitute glyphosate right in there as a glycine analog. So when you're doing that during protein synthesis, you're making non-functional proteins, right? And a lot of those non-functional proteins that have been studied with Dr. Seneff are the ones that bind and utilize sulfate. So that's one part of the story. And the other part of the story is that glyphosate will disrupt the enzymes in the bacteria in our digestive system that convert sulfite to sulfate and that convert sulfate into the form that helps to transport things into our body, right? So you get a decrease in the sulfate and sulfite that are able to be used by those good bacteria in our bodies to make methionine so that we can have that methionine. That's only one that they impact, though. They also impact tryptophan, tyrosine, and phenylalanine because those particular species that are using this pathway to make the methionine for us are also making our tryptophan, our phenylalanine, and our tyrosine. So all of that becomes a deficit in our bodies. And those are important neurochemicals that we need. We need those, all of them. And so if all of these things are suppressed, then ultimately that leads to a sulfur deficiency because methionine is the universal sulfur donor. That's where we get all of our sulfur from. in the plant form. I'm sorry, in the animal form. It's from the methionine amino acid.
So, as far as like, folks listening, thinking like, okay, so, glyphosate, Roundup, GMO crops, all that. So, if someone's listening to this thinking like, well, I've been eating organic food for the last 10 years, so maybe this doesn't apply to me, what would your response be to that, Dr. Janelle?
It's everywhere. It's in the rain. At MIT, they've taken rain samples from all over the world, and it's more concentrated in populations where there's more of a concentration of population, like in cities. But it's everywhere. It doesn't go away, it's everywhere. So if you live on this planet, you are exposed to glyphosate. Babies can be born and be tested and be positive for glyphosate. Even if you eat organic, you're going to get drift even from crop to crop field. There's nothing to protect that from happening. And there's copious amounts of it being used. They don't just use it in the growth process where it actually is incorporated into the tissue of the plant, right? You can't wash it off, it's in there. But in addition to that, it's used after harvest. So, you want to keep your corn fresh or whatever crop it is you're growing, you spray it down with glyphosate in the trucks that are transporting it, in the warehouses that are storing it, so that you continue to have a good crop. It's literally everywhere.
Yeah, it's quite unfortunate, some of the choices that our fellow humans have made, because it impacts all of us, and we didn't get a say in it. But yeah, it's quite pervasive to say the least. Just
There are bans, actually. Sorry, there are bans in Europe and Mexico.
Yeah, I think I remember. I think you showed us a world map during your course. I think of like there weren't many places where it was banned, but there were a few anyways, which was encouraging to see.
Yeah.
Um, just as a little side note, and actually, sorry, this is a good segue for me to just mention, as per usual, nothing discussed in these podcast episodes, including this one, should be construed as medical advice. This is all for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. I'm just wondering, I know some docs out there or other clinicians talk about these kind of like glyphosate detox protocols. And I'm just wondering if there's anything that you recommend for your patients or that you think about for like kind of trying to get, I don't know, glyphosate residues out of folks?
Yeah, that's a tough question. If it's incorporated into our amino acids, then it's pretty difficult to get rid of it, really. I mean, the answer is banning it. That's bigger than you or I. Um, and glyphosate does move through, like the studies that were done by Monsanto, for example, to show that it's not a problem for us. They show it, you ingest it, it passes through the urine. So you do pretty much, you're getting rid of it all the time through the urine. But it's that part that gets stuck in the building of your body that's really hard to get rid of. So I don't have any kind of amazing protocols besides avoiding, the best you can, avoiding and eating organic foods, avoiding GMO foods if you can. And then all of the healthy things that you and I always promote, like getting outside and getting exercise and getting enough sleep and doing saunas for detox. But if you think about, cysteine being an amino acids being builds proteins, that means that you're getting these things stuck in not only the enzymes, but in the muscle protein. How do you break down muscle protein and detox that?
I've heard some folks talk about just like taking in higher dose glycine supplements to try to like, I don't know, fight fire with fire, where it's like, well, if there's a glycine analog in the form of, glyphosate, getting into the body, then, and that's getting picked up and incorporating into proteins. If you mainline glycine into your system, I know a lot of folks, at least around here, take magnesium glycinate, magnesium bound to the amino acid glycine. Um, Do you think there's any potential role? Like, I'm not aware of any studies looking at that, but do you think there's any potential role for something like that, or is that too wishful thinking?
Let me just say, I would hope so. I would hope that would have an impact. I don't know, and I haven't found anything in the literature.
Yeah, yeah, me too. Um, And then you were mentioning just about sulfur metabolism, and you also earlier mentioned about hydrogen sulfide. So it might be a good time to talk about that, please.
Sure. Yeah. Yeah. That segues right into it. So, um, funny story. I just want to go back in the years. Okay, let's go back into the late 90s when I had patients coming to me, and I was, GI practice at that time. So they were coming to me and had come from, maybe they had inflammatory bowel disease. They were coming from their GI doc, and they had a message for me, which was, my gastroenterologist wants me to tell you that there's no bacteria in my digestive system. And how I'm using that to frame how far we've come, right? And I think the real shift in the interest in the microbiome happened when we started using fecal microbial transplants for people with intractable Clostridium difficile, and nothing else was working. And, the majority of those people recovered and recovered. They were done with their infections. So that put a spotlight on what the heck is in this that is so important to our health. Well, now, fast forward decades later, and we know so much about the microbiome and how it interacts with our bodies and how it's releasing these chemical messengers, these end stage messengers into our body. So our body is literally communicating all the time with the gut microbiome via those chemical messengers. So if the body knows that it's low in sulfur, it's going to tell the gut, hey, you guys in there, upregulate for me whatever you can, because we need more sulfur in the body. So disulfovibrio and fusobacterium, those guys can overgrow now. And instead of doing the pathway where they're actually helping us build methionine, they shift over to a compensation by now making hydrogen sulfide. Hydrogen sulfide is a gas. It's a teeny tiny little molecule. It also diffuses directly into the tissues. Doesn't even have to go through the blood. It's so small. So it's going to go directly into the tissues. It's lighter than oxygen. It's going to head up to the brain. In the brain has a mechanism to convert hydrogen sulfate to sulfate. Hydrogen sulfide, sorry, to sulfate. So it's not a great solution, but it is a solution to get more sulfur in our bodies. So I believe, because of my clinical experience, that a lot of these fermentation syndromes that people have are really based on this sulfur deficiency. And once you give the body what it needs and it's able to downregulate those species that are compensating, you can go back to a healthier homeostasis in the microbiome.
On that note, because I've heard, do you know or know of Dr. Greg Nye by chance?
Of course I do.
Oh, okay. Yeah. So one of the smartest people I've ever met, like just such a amazing guy. And so I know he's been lecturing and talking here and there about sulfur metabolism. I know he's, well, yeah, of course, if you know Dr. Senef, they know they've co-published a paper or two together, I think. And
Yeah.
anyways, so he's the first person I ever heard speak about the idea like, oh, maybe hydrogen sulfide gas producing SIBO is a compensation for, some of the things you just very succinctly spoke about there. And so I'm just wondering because, like in my practice, like I've run like literally like a few thousand lactulose breath tests in my day. We really don't do the trio SPART testing that's out there now that's able to test directly for hydrogen sulfide gas because just the price point here in beautiful Canada is like, works out to with the exchange rate to be around, I don't know, $1,000 or something like that to do a test versus a little over $100 to do a regular lactulose breath test. So we don't really get to see those, but I know, to my understanding, there are, some ways to maybe, not maybe 100% accurately, but some ways get some extrapolation from a standard lactulose breath test where, if there's kind of really kind of like flatline hydrogen, flatline methane, we can maybe extrapolate from that, then maybe there's hydrogen sulfide, then bring in Trio Smart, and it's like, oh no, we can see that even when there is the presence of methane and hydrogen gas producing SIBO, that there can be hydrogen sulfide as well. They can all coexist together in some dysfunctional, happy family kind of thing. And so I'm just wondering, in your experience, where maybe if you've seen more Trio Smarts or tests that are actually looking directly at hydrogen sulfide. Is it quite a prevalent subtype of SIBO? And I'm just wondering where other types of SIBO seem to be more dominant, or is there evidence that there's quite a bit more hydrogen sulfide producing SIBO out there?
My population might be skewed just because people are finding me because they know they have a hydrogen sulfide problem based on the
Okay,
testing. And I can tell you that they respond really well to the treatment, to the hydrosulfur treatment. So that definitely, helps to validate this idea that there's a deficiency. So no, in terms of proportions, most of my patients come to me with a stack of SIBO tests. Right? They'll come to me and they've been through this over and over and over again because I practice in an area where that's the norm, right? The norm is test Xifaxan, test Xifaxan. So people will find me through either, my writing or YouTube or whatever, and they'll say, well, this is really different. This is really different. And I want to see what this is all about. So they'll be pre-tested, right? And a lot of those, again, are going to be positive for the hydrogen sulfide. Not all of them, though. So, and I still get good results. So was that, did it not come up on the test? Was that a false positive? Like, I don't know, but it does seem like the overgrowth of the methanogens and the hydrogen producing bacteria are potentially downstream from that sulfur deficiency as well. And that comes back to creating that alpha diversity within the small and large intestine by replacing that deficiency.
makes sense. Okay.
Yeah, definitely see good responses. And, like I will lead with the product that I formulated, which is the GI Janelle 1 powder. That's the hydrous MSM powder that I use. And we'll do that first because for the majority of people, it's going to take care of the problem. They've already had tons of testing done. They don't need any more testing done. If they want to repeat it afterwards, they usually don't, because it's like, I'm better, goodbye.
Yeah, absolutely. And which is understandable. They're not, guinea pigs in a lab, right? It's like, yeah,
No,
that's
and
your life.
if they feel like, okay, this problem is gone, they're going to move on to their lives, right? They don't have to deal with this anymore. So, no, I've really never, maybe one or two people, but nothing that stands out to me that says, okay, we retested. The symptoms are gone. I think that's your answer right there. And, um, I remember learning 30 years ago that you can only rely so much on testing, right? That part of our job as medical detectives is to sit and listen to the patient, and you're going to get 80% of what you need to know just by asking your questions and finding out. And it seems like the longer you're in practice, the more true that is.
Well, if you don't mind, Dr. Janelle, I do have a list of questions here. Maybe I know the time's starting to wind down a little bit. And so could I maybe just ask you a few kind of rapid fire questions? So I've
Sure
been
thing.
thinking about MSM a lot. As I mentioned to you before we started recording, I've been using this quite a lot in practice since taking your course, which I'm very thankful for. And so I just have a bunch of random miscellaneous questions if you're okay with that. Um,
Absolutely.
so I'm just wondering if memory serves. I believe that during your course you indicated that while folks could take MSM and divided doses through the day, seems to work comparably well just taking it once a day, like just in one big bolus. So if I did hear that correctly, have you had any patients that do seem to either tolerate MSM better or somehow get better results taking it, say, two to three divided doses through the day instead of all at once?
I'll tell you what the compounding pharmacist told me a long time ago. And that was if you get it in within that 24-hour period, that's all you need to do. So if you take it in one dose, or you've divided up into 6 doses, it really doesn't matter. It becomes more of a personal preference. I have had people tell me that they feel that it's more effective when they take it between meals, but then it's also worked when people take it at meals. So it really is that 24-hour window where you want to get your dosing in, whatever level you happen to be at if you're doing a titration.
Okay, great. And then again, if memory serves, please correct me if I'm wrong with any of this, but I believe during your course you mentioned that, folks will need to build up to whatever dose they need to build up to, and then they're seeing their therapeutic results, and then they'll, be able to titrate the dose down over time. But then some folks do need to continue to seem to need to take the MSM, longer term or very long term potentially to kind of keep those benefits going, potentially because they are still prone to sulfur deficiency because they're still living in a world with glyphosate, et cetera. And so if I have my facts together there, if that is the case, I'm just wondering, how often do you find that your patients need to stay on some maintenance dose of MSM, like just percentage wise, roughly?
I'm kind of at the point now where I want people to stay on a maintenance dose, at least like a 2.5 to 5 milligram dose every day, just because I know it has so many other benefits for their system in terms of, being an antihistamine, anti-inflammatory, building tissue, even, the structure of your skin, right? All of the connective tissue that requires that sulfur-based protein, the collagen, right? The fact that collagen is held together by heparan sulfate. So if you take hydrolyzed collagen, you're getting part of the molecule you want to rebuild in your body, but you need the sulfur to actually hold it all together. So I like to keep, at this point, I'm keeping people in a low maintenance dose if they're willing, just as part of their health protocol, right? Their overall health protocol. In terms of symptoms returning, it's pretty rare that I need to keep someone on a moderately high dose, like let's say 15 grams a day, which would be half the therapeutic dose. But I have had a handful of people over the years who say, you know what? I feel like if I don't take this much every day, I start to notice symptoms that I don't like. So in that case, because of the safety of it, I'm fine with that happening. And then there's a third contingent, and that would be the people who don't respond, right? Because nothing is a panacea. It's not always one problem. We're so complex. So I'd say there's maybe 20% of the people that don't respond to this, don't get complete elimination of their symptoms that's permanent. And in that case, the majority of these people who have been through a lot of antibiotics over the course of their life, and their problem is really fungal and they need a stronger antifungal. Usually the fermentation that I see that persists after doing the full 8-week course of the GI1 powder. It persists in the lower abdomen, where you're more likely to get a fungal versus a bacterial overgrowth, because that system is literally a bacterial system, right? Your colon is a fermentation warehouse. That's what's happening down there, and you've got a lot of bacteria. So, I kind of go back to the old term dysbiosis in the large intestine, because bacterial overgrowth in the large intestine, I don't think there's room for more overgrowth. That's what's there, but fungal overgrowth for sure. So at that point, if with that 20% population, I'll go in with some kind of prescription antifungal. They need something stronger. And that usually clears things up. It's very rare that it doesn't.
Okay. And you mentioned the heparan sulfate, and I'm just wondering, I've had a couple of patients to date now who have noticed some significant improvements related to blood flow in their bodies. And I'm just wondering, like with taking the high dose MSM or high dose sulfur protocol, I'm just wondering, this is maybe just a little bit of a, I don't know, thought experiment here, but we of course had the COVID-19 pandemic, a lot of folks with circulation related issues related to that and various things surrounding that. Just wondering if you could speak to any experience that you've had where high dose MSM seems to be helpful with circulation related challenges or symptoms.
Incredibly important. So there's a research scientist, Dr. Pollack, who's out of the University of Washington, and he's really close with Dr. Seneff because they're both working on sulfur. And just, I want to say one thing about Greg Nye, who I agree is absolutely brilliant. He does the opposite treatment, right? He limits sulfur in the diet. And I've seen patients of his who haven't really responded to that. I think that some of the foods that he limits are actually inflammatory foods, and that's one of the reasons people are getting benefit, right? Like your dairy and your eggs, and those are things I take out of the diet too. So he kind of starts with Dr. Seneff's research and Dr. Pollack's research, and then limit sulfur. I start with their research and I say that they're sulfur deficient. And then we work with the sulfur. So two completely different avenues with that. Where I was headed though was Dr. Pollack, University of Washington, has discovered that there's a fourth phase of water, right? So we know that things in our world exist in different phases, right? So water can be ice, which is solid. Water can be vapor, which is steam. Water can be liquid, which is what we drink. And he's found that there's this fourth phase of water called exclusion zone water. She's got papers about it. And that is a gel form of water. So liquid, solid, vapors, gel. And that gel form of water lines all of our blood vessels. It lines anything that is suspended in blood so it can move through those vessels more easily, right? It stops the red blood cells from sticking to each other, which we don't want. So in terms of the vascular system, well, not only that, but as a transport molecule, sulfate transports any kind of ring structure, right? So tyrosine, phenylalanine, vitamin D, cholesterol. You have to have cholesterol sulfated in order to transport it through the liquid medium of the blood. And it does that by attaching sulfate. So any ring structure is sulfated for transport. And you can see that I'm trying to make a link there between cardiovascular disease and the impact of having, blood clots, irritation, inflammation, and then packing cholesterol in there as a possible link to, again, a sulfur deficiency, something that wouldn't show up, from moment to moment, but over time has that insidious effect. So in terms of, circulation.
Okay. Very interesting. I've just clinically, what are some of the have you had patients report circulation related symptom improvement from MSM dosing?
Off and on, yeah.
Okay. Yeah, I find it's not everyone, but like there's just been a few who've been like, oh wow, like things are, I don't know, been going very well. So
Good.
um, yeah, I interviewed Dr. Nye earlier this year actually for the podcast, and he was talking about the exclusion zone water as well, because I had sulfur on the brain as I'd done your course not long before then, and so I was telling him about your course actually. It's like it is interesting how like it's kind of the polar opposite of include and disclude. Anyways, so I hope he took the course, and be curious to see what he thinks about it. Um,
Absolutely. I would love to talk to him actually about it because I'm sure that he's seeing things from one perspective. I'm seeing things from a different perspective. Of course, you're going to go towards whatever clinically manifests for you
yeah,
in success with your patients. Right?
yeah. I remember talking to him at a conference about like just getting more sulfur into the system because anyways, I think I feel like you guys are kind of talking about it differently, just from like an bring more sulfur, exclude sulfur. But I think it's for him more like excluding sulfur-rich foods. But I think he's ultimately, I believe he was saying the same thing, that like, oh, the hydrogen sulfide is a compensation for not having enough sulfate. So he was talking to me like, about, he was playing around with Epsom salt baths, and he was like, oh,
Mhm.
maybe giving people like chondroitin sulfate and glucosamine sulfate. It's like, oh, or MSM. So, anyways. I think you're talking about the same thing, maybe just coming at it from slightly different angles. But anyways, we need to get the two of you together on a podcast to hash this out, and probably all, come up to the similar conclusions would not be my guess. But so going back to the rapid fire here, that's not going rapidly at all because I keep going down rabbit holes here with you. But so circling back to the digestive tract, and I'm not saying this is my perspective, but I'm just curious what your answer would be if someone, came in like devil's advocate saying like, yeah, that MSM, like when I take it in a powder, by golly, it's mighty bitter tasting. And maybe all the digestive benefits are because you're just giving like the ultimate bitters formula. You're just stimulating the heck out of the patient's digestive processes, and that's what's leading to all these benefits. So I'm just wondering if you think there's any type of therapeutic benefit from that incredibly bitter taste of that MSM powder if folks are taking it in a powder form.
That's a good thought. That's definitely a good thought. I mean, certainly bitters are something that we've used for centuries, right? I mean, the aperitif kind of idea of bitters has been around for a long, long time, to stimulate that digestive process. I don't think it could hurt, but I don't think that's entirely it either. And what I base that on is just having tried so many things with patients over the years before I started doing this, and having them use bitter formulas, or having them use HCl or pancreatic enzymes, or combinations of those things, and not really getting the needle moving on the symptoms. So I'm sure it does have some of that bitter effect. And I really like that idea. As a naturopath, I like that idea that we're working with the body's processes. But I don't think that's entirely what's happening.
Yeah, I agree for similar reasons as well. Although in the last maybe month or so, I've actually switched my explanation to patients. I would always kind of go into it a bit apologetically, saying like, stuff's great, but like it is pretty bitter, and now I'm saying like, and guess what? And it's bitter, and so you get this bitters effect as well. So
Mm-hmm.
anyway, so I've switched my mindset on it a little bit. So, anyways,
I mean, I'm going to do that too. Good.
um, and
Make
then
it a positive.
there we go. Yeah. And then another question I have for you, and I've been meaning to get into the biochemistry of this, and I haven't had a chance. But if anyone has, I'm sure you have. Just where MSM, of course, as you know, and for listeners, it's methyl sulfonyl methane, so it's methylated. And I'm just wondering, like, is there any chance that taking MSM somehow contributes to our methylation cycle in a more direct way?
No, it can't. And there's a YouTube video up on my channel about that,
Okay.
where I actually have the methylation cycle behind me and I go through it. But the methylation cycle starts with methionine. Methionine is an essential amino acid. We can't make it, right? We have to get it in our diet, or from the bacteria that are helping to convert that methionine in the PAPS cycle in our intestines. So we can't make methionine, so we can't push that cycle. So methionine is an essential amino acid. We get it in, it feeds into the methylation cycle, it circles around, and it gets turned into homocysteine. It's a circle, so it keeps on going, right? Turns to homocysteine. The homocysteine then goes into the transsulfuration cycle, which is where we convert sulfide to sulfate. So it can't really feed into either of those two pathways. Now, can it liberate this is the only place I've been able to really wrap my mind around even some of the side effects that people have and their response if we upregulate the sulfide oxidase using molybdenum, because it does seem to work. So are we liberating some of our other sulfur-based molecules like glutathione, like NAC, in the body, and making some extra sulfite at the very end of that cycle? And that's causing some, ramp up irritations for people. That's the only place where I can see that makes sense, because that entire pathway cannot be impacted directly because we can't make the start point.
So, and I mean, again, I haven't looked into it, so and appreciate feedback here. But just would there be any way that that methyl group from MSM could potentially methylate homocysteine back into methionine, like somehow, I don't know, replacing or circumventing the need for, because like there's the short pathway shunt, like with like the BHMT enzyme getting homocysteine back into methionine through trimethylglycine, the longer around pathway with using, methylfolate and methyl B12, like, is there some way that MSM, like, that methyl could somehow methylate homocysteine? That's kind of the way I was thinking of it more so as opposed to directly intercalating itself in the cycle.
Yeah, I think that's a stretch for me, because, we're carbon hydrogen based entities, right? Like the backbone of a lot of our structure is carbon and hydrogen. And methyl methyl group is simply a carbon attached to three hydrogens, and we're getting that in our food all the time in various forms, and we're having that circulate around in our body. So just that, little bit of extra, I guess I would say maybe, but there's so many methyl groups in our body all the time floating around. It's hard to think that that could easily feed into that system where the body would need that in order to, upregulate that system.
Well, I appreciate the thought, experiment engagement there. So, been curious about that one. So, thanks for the feedback there. If there was a patient who, for some reason, just could not tolerate taking MSM for some reason, I don't know why they wouldn't be able to, but if they couldn't for some reason, are there any other forms of sulfur that a patient can work with therapeutically, like break into a chemistry lab and just get a hunk of that yellow, stinky stuff?
There's a toxicity level, right? So in the form of MSM is the safest form. MSM is directly derived in some cases from something called DMSO, dimethyl sulfoxide, which also has a really high toxicity, a really, low level that you can take before you're going to make yourself really sick. So the thing about MSM is that it's so well tolerated. And that's the reason why I use it. Even things like NAC, which, the kids are calling NAC these days. I've never heard of that before. I'm like, what's this NAC? So NAC and glutathione, right? There's these sulfur-based nutrients that we can actually take to upregulate our bodies, but they're they're probably cost prohibitive too, because MSM is really available to people. Um, and in the doses you need to take, right? I can imagine like thinking about a capsule of like liposomal glutathione containing maybe 300 milligrams. So that would be a lot of pills to take in a day. I haven't experimented with that. I just have had so much good luck with using the methylsulfonomethane that I really haven't needed to.
Okay. Yeah, I haven't run into anyone who can't tolerate it. Just I like to plan for a rainy day, so I thought I'd ask, but
Oh, yeah. Well, there definitely are some, like I said, there's some ramp up issues for people that almost always go away at the point where things are becoming, digestively, things are becoming much better. Like some people say they're getting headaches. That might be directly from the MSM. Um, that might be from some kind of detoxification reaction that's happening in the brain. I don't know. I've been reading and reading and reading and looking for something direct, but I haven't come across that yet. I have come across some really great antimicrobial and antifungal studies directly done with MSM, that are fantastic. And I can, nerd out for days on those. Um, some people say they get insomnia. All of these things happen at the lower doses and resolve at the higher doses. I've never seen anyone persist there. So I just encourage my patients. It's like, okay, that's a good sign that your body is using this stuff. We'll just slow down the roll, slow and steady. Don't increase your dose until that symptom has resolved. Go up a little bit. If it happens, hold it there, hold your daily dose there until that goes away. And eventually it just stops and they can go up and do a therapeutic dose.
I'm just going to ask you one more question, Dr. Janelle, because I know our time is winding down here. I've had many patients over the years where we've had a lot of great success getting their chronic digestive symptoms under control. They had a history of constipation. We'll usually get them on magnesium to get their bowels moving. We treat their SIBO, their whatever. They're feeling really good, but then they are stuck on magnesium, and they're taking maybe 2, 4, 6, 8 capsules a day, and they're just kind of stuck on that. And they're generally don't complain about it. They're happy they're not constipated. They're feeling good. It's like whatever. They're fine with it. I used to tell myself, so I'd like to try to figure out why the heck things are happening in practice, naturopathic doctor, root cause, all that good stuff. What does the body need? I used to just tell myself, well, it's a stressful world that we live in. Maybe they're just burning through more magnesium. They need it for, stress mitigation or something like that. But then hearing your lecture and now seeing with my own patients, their magnesium dosages, going down, not needing as much magnesium, some of them not needing it anymore. Like that was one of the most exciting things one of the many things I was excited about with learning from you about this. And so I'm wondering, in your experience, the folks that do have, chronic constipation, and let's just say maybe like that subset of patients who are, just kind of medicating their constipation one way or the other, Restorelax or Laxaday or, magnesium, vitamin C, whatever they're taking, some osmotic laxative. How often is it that you see MSM, able to fully resolve, chronic idiopathic constipation, assuming there's no, anatomical explanation or something like that for it?
Mhm. Um, I see people being able to lower their magnesium doses all the time. And during the course of the treatment, I mean, magnesium is osmotic, right? So during the course of the treatment, that MSM is now becoming osmotic as well, right? And so it's helping draw water into the colon and helping to make the stools less hard by drawing that water in, right? So there's that one aspect. But the other aspect is that you're absorbing a whole bunch of MSM into your body. And that MSM is giving you the sulfur that you need to create elasticity in connective tissue, right? Sulfur creates connective tissue that is strong and flexible, right? So we need it in our skin. We need it anywhere where we need contraction, expansion. So as you're going through the course of that MSM ramp up, you're actually supplying the sulfur that you need to create more motility within the connective tissue of the skin. So you're repairing that, and the body's repairing it, right? You're not doing it. Your body knows what to do. It's repairing that for you. So motility actually increases right from the cellular level. And that's why you can end up with people who need, in the end, even when they're off the high dose of the MSM, they need less magnesium to move their bowels. And you asked, resolving intractable constipation. Those people who will always need some, but not ridiculous amounts anymore.
And maybe just a follow-up question to that, if you don't mind. With those chronic constipation cases, what would be, say, like an average, well, so what would be the range, what would be the range of timeline that it might take to get them sort of the maximal results for that constipation? Like, let's say someone builds up to 30 grams of MSM, their bowels are, everything's going well, their magnesium dose is maybe gradually going down. How long might they need to be on that magnesium for? What would the range be like before they're going to kind of see their, optimal results with the protocol?
Well, they will by the end of the 8-week protocol. Whatever they end
Okay.
up with at the end of that high dose titration, and they land on the 30 grams and they hold that for 8 weeks, and they can work with their magnesium dose at the same time, which is really wonderful that you discovered that in your patient population. And that's one thing I tell people too, is that you're going to be working with the magnesium dose because you won't need as much. And then when you get to the end of the 8 weeks of the 30 grams, then whatever they landed at there with their magnesium dosing, you can go ahead and just continue to work with that to see if you can bring it down anymore. But, if it's the question between being chronically constipated and taking some extra magnesium, I mean, I think that's a pretty safe bet that that's a good thing to use. And I usually use the really cheap form of magnesium. I use magnesium oxide and hydroxide when I'm exclusively dealing with the osmotic effect, because it's not absorbed as easily as some of the other forms of magnesium. And so you're getting it to remain in the digestive system.
Sense. Well, Dr. Janelle, I know that you mentioned that you might want to chat with me a little bit about some of my experience in practice so far with MSM. That being said, I think we're officially cutting into your lunch break at this point, so I don't want to keep you longer than you have. So I can riff a little bit for a couple of minutes, or we can just wrap things
I would
up.
love to hear your experience.
Sure. Yeah, I can summarize it pretty well, I think. Yeah, so I've had just a growing number of patients that I've started bringing MSM much earlier into the treatment protocol. Like when I first started using it, it was mostly like just bringing out the cases that were, really tough. We were struggling with, trying to, chronic cases where maybe they hit a plateau. And I've been seeing those patients getting gradually better, which has been the most, exciting part of it for me. I have two cases that were just, didn't respond to anything, like no response to any of the SIBO treatments, high dose digestive enzymes, every diet you can think of under the sun, et cetera, et cetera, et cetera. They're doing really, really well now with their bloating and bowel regulation getting under control. So still a work in progress. Everyone's building up kind of gradually. A lot of my patients are really sensitive, so hitting some little speed bumps along the way, needing to, build up a little bit, maybe slower than average for some of them. But a couple of my really tough cases, it seems like the MSM is cracking those digestive cases, which is really exciting. I have a growing number of patients with arthritis that have been noticing improvements with their joint pain and joint issues. So I'm recommending it all the time now for folks. I do a lot of orthopedic injections like prolotherapy and ozone injections and stuff like that. So that seems to be a really nice complement and synergy with that. So they don't seem to be needing as many treatments. The treatments seem to be working better because I think there's a synergy between the two. Have maybe three patients or maybe four patients now where try as we might, nothing was helping with their thinning, brittle hair, and their hair is doing better now, or like hair loss, that's doing better, which has been exciting. A lot of folks reporting that their nails are more, have better integrity. I feel like I've got a couple of other good anecdotes too, but those would be the main. Anyways, those are some of the highlights. So yeah, it's been quite. Oh, and then just I'm taking it personally myself, and I'm surviving my jujitsu classes a lot better now with all the guys that are half my age. So I'm like, I'm sold on it for me personally too. So yeah, lots of great benefits. I'm really excited about it.
That's wonderful. I'm really glad to hear that.
Yeah. So thank you again for teaching about this. And thank you so much for speaking with me today, Dr. Janelle. Just before we wrap up today, would you mind just sharing with folks where they can find you online? Tell us about your supplement line, where they can find you on social media.
Absolutely. So online, I've got a YouTube channel at GI Janelle, and I'm always putting up videos because people are asking me questions during the day, and then I'll think, oh, I should talk to that point. So for me, that's really fun to be able to, say, here's another answer for you, and think about this. So that's on YouTube, but all those videos are also on TikTok, GI Janelle. They're on Instagram and Facebook at GI Janelle. So all of those places, I try and get everything across the platforms. My website is gijanelle.com. And there's a link to my book there. You can also get it on Amazon or download it from Amazon. And that's where you can order any of the supplements that we've formulated. So I have a line of digestive enzymes, as well as one of the other things I use a lot is a really concentrated aloe, very concentrated mucopolysaccharides. And I find that works for healing even better than things like deglycerin, licorice. Just lost my train of thought there. And also in the GI1 powder that I formulated, that's got the MSM in there. It's also got a little bit of acacia fiber because I'm trying to gradually get some prebiotic activity in there, as well as some althea and ulmus, which are marshmallow and slippery elm. So those are also helping soothe the gastrointestinal lining. So I use that as a package. So when people are titrating, they're getting more of all of those things together. And right now we can ship any of those. The GI1, we just keep on running out of stock because people are hearing about this, and we can ship anywhere across the US right now. We're working on labeling for Canada, getting a barcode and getting French on the label so we can get it in there. And yeah, that's basically how it's all done online. So all you have to do is go to the website.
Okay, great. Well, I will put the links to all of those in the show notes and in the description on the YouTube video. And yeah, thank you so much again for taking the time to chat with me today. It was really, really a pleasure.
Thanks. You too.
And thanks so much to everyone who listened to this episode of the Overcoming Chronic Illness podcast. We hope you enjoyed it and stay tuned for the next one.